regular meeting of the Board of Selectmen. This open meeting of the board is being conducted remotely, consistent with Governor Baker's executive order of June 16, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the board are allowed and encouraged to participate remotely. The order allows the board to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda. Members of the public who wish to view the live stream of this meeting may do so in a number of ways, all of which are documented at the top of our agenda. There's the live stream YouTube link, which is available on the agenda, or you can go to the town website, look for remote meeting button, and that will take you to the link to get to this meeting. There's the Zoom webinar link. There's the phone number to call in on the Zoom webinar for audio access only. And additionally, we have Northborough Cable Access providing government channel transmission on Verizon Channel 30 and Charter Channel 192. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. I'd now like to confirm the presence and accessibility of the board members who are here with us this evening. I'm Jason Perot, Chairman. Vice Chair Leslie Rattan.
Present.
Clerk Scott Rogers.
Present.
Member Julianne Hirsch.
Present.
And member Kristen Wickstead.
Present.
Now I'd like to confirm the accessibility of the staff members who will be participating in the meeting this evening. Town Administrator John Coder.
Present.
Assistant Town Administrator Becca Meekins.
Present.
Public Works Director Scott Charpentier.
Present.
Police Chief William Liver.
Present.
And Fire Chief and also our Zoom host for the evening, David Parenti.
Present.
And as mentioned, we also have Northborough Cable Access Services this evening. Just to cover the ground rules briefly, as chair, I will invite each speaker or applicant on the agenda to make a presentation and speak to their application. Participants will provide their full name. Each speaker will be asked to mute their phone or computer when not speaking and to speak clearly and in a way that helps generate accurate meeting minutes. Those responding will be asked to wait until the floor is yielded to them by the chair. Speakers who wish to respond to the comments of others, please request to do so through the chair. And each vote taken by the board this evening will be conducted by a roll call. We'll review the details of public comment when we reach a portion of our agenda that requires that. And I think that'll do it for the preliminaries. So to begin with the agenda, first item is approval of the December 14, 2021 meeting minutes. Do I have a motion?
Mr. Chair,
Scott?
I move we vote to approve the December 14th, 2021 meeting minutes as presented.
Second.
Moved by Scott Rogers, seconded by Leslie Rattan. Any discussion? Seeing none, this is a roll call vote. Kristen Wickstead.
Should I just abstain? I didn't come
That
to
would be
that.
correct.
Yeah,
Yes.
okay, so I
Yeah.
abstain, thanks.
Okay. Julianne Hirsch.
Aye.
Scott Rogers.
Aye.
Leslie Rattan.
Aye.
And I, Jason Perot, vote aye. So that carries 4 in favor, 1 abstention. Next item is the approval of the December 20, 2021 meeting minutes. This was a brief Board of Selectmen meeting.
Yeah, Mr.
Do
Chair.
I have a motion? Yes.
I move we vote to approve the December 20, 2021 meeting minutes.
Second.
Moved by Scott Rogers, seconded by Leslie Rattan. Any discussion? Seeing none, this is a roll call vote. Kristen Wickstead.
Aye.
Julianne Hirsch.
Aye.
Scott Rogers.
Aye.
Leslie Rattan.
Aye.
And I, Jason Perot, vote aye. Carries 5 in favor. And finally, approval of the December 20, 2021 joint meeting minutes. This was the Financial Trend Monitoring System meeting
Yeah, Mr.
covering
Chair.
the school committee the Financial Planning Committee and the Appropriations Committee. Scott Rogers, yes.
Yeah, I move to vote I move that we vote to approve the December 20th, 2021 joint meeting minutes.
Second.
Moved by Scott Rogers, seconded by Leslie Rattan. Any discussion? Seeing none, this is a roll call vote. Kristen Wickstead,
Aye.
Julianne Hirsch,
Aye.
Scott Rogers,
Aye.
Leslie Rattan,
Aye.
and I, Jason Perot, vote aye. Carries unanimously, 5 in favor. John, we had agreed that that meeting was conducted as a Board of Selectmen meeting, and there'd just be this one set of minutes, which now that they're approved, we'll distribute to the other boards and committees for their review.
Correct.
Very good. It's now past the hour of 7 p.m. And do we have an applicant here?
Yes, Mr. Chair, we do active promoter if you'd like me to.
Yes, please do so. Thank you. This is Steak Loft Bar and Grill, doing business as name change for all alcoholic beverages restaurant license located at 369 West Main Street. Steak Loft Bar and Grill changing to the Cellar Bar and Grill. And hello, could you please introduce yourself?
Hi, my name is Evis Agora.
Hello, welcome this evening.
Happy New Year.
Happy New Year. Could you, we have the application in front of us, and as you say, this is just a business name change. There's no transfer of license or anything else going on that requires greater scrutiny. Would you care to just give us a few details about the name change and what you're planning to do?
We since it's going to be a new ownership and it's going to be new owners and everything else is going to be new on that, we decided to come with a new name too, from Steak Loft to the Cellar Bar and Grill.
Very good. Board members, any questions? Leslie?
Hi, good evening. Thanks for being here. It was mentioned that there might be some cosmetic changes that you might undertake as part of this. What kind of things do you envision doing there?
Well, the place has been old, so we're changing a lot of things over there. But besides that, we just want to come up with new menu and more new stuff. We've been in the business for a long time, so we just wanted to do something different.
Mm-hmm.
New tables.
Sounds good.
Everything is new. The whole place is going to be brand new. It's been so old. They haven't been updated for 40 years. So we decided to do something different.
Mm-hmm. Will there be some construction going on inside, or is it literally just?
There is construction going on. We're just updating one room at a time. So the place needed a lot of work, and we're working on that. And besides that, we're working on the name. We worked on the name. We found a new name, and then the other things just menu now.
Mm-hmm. Mm-hmm. Sounds wonderful. Well, good luck with everything.
Thank you.
Very good. Board members, any other questions or comments? Seeing none, do I have a motion?
Mr. Chair, I move the board vote to approve the application to change the doing business as name for the all alcoholic beverages restaurant license for premises located at 369 West Main Street from the Steak Loft Bar and Grill to the Cellar Bar and Grill.
Second.
Motion by Leslie Rattan, second by Scott Rogers. Any further discussion? Seeing none, this is a roll call vote. Kristen Wickstead,
Aye.
Julianne Hirsch,
Aye.
Scott Rogers,
Aye.
Leslie Rattan,
Aye.
and I, Jason Perot, vote aye. So it carries unanimously. Congratulations on the name change, and we look forward to seeing the new facility.
Thank you. Thank you very much. Wishing you a great evening. Thank you.
Happy New Year. Good luck.
Happy New Year.
Thank you. Happy New Year to you too. Thanks.
Good night. Next up, it's past this hour of 7:05 p.m. and we have Kristen Black, health agent, with a COVID-19 update.
He's on the way in.
Very good. Thank you, Chief.
Thank you, Mr. Chair. You cut out a bit there, but hello, Board of Selectmen. It's nice to see you all. It's been a pretty rough week in public health. Unfortunately, if you're following state numbers, I'm going to give a brief presentation. If Chief, you can allow me to share my screen. Okay.
You should be all set.
All right. Thank you. Just bear with me a minute. And sorry. Okay. Does that work for everybody? Can you see that screen okay?
Yes.
Okay,
Yes.
great. So today on January 10th, here's the local Board of Health update. So I'm going to briefly cover our current case counts of the last few weeks, breeze over and fill you in on the recent townwide mask mandate per the order of the Northborough Board of Health that's effective today. Talk a little bit about COVID-19 testing in our community, detail you on the upcoming vaccination clinics, and discuss our current contact tracing of COVID-19 cases and take any other questions you may have. So this graph here is a little frightening. You can see we're in our greatest surge so far for cases. So currently we have approximately over 500 active cases. We've really never seen numbers anywhere near even half of that amount. The schools, statewide, we're really seeing that same trend. So in the last month period or 30-day period from December 10th through January 10th, we've had 787 positive COVID-19 cases in town. And those cases are ones that are reported through the state's MAVEN system, where all of the lab run tests. So if you go to a ReadyMed and they run an antigen or a PCR test, or you go to Stop the Spread, we see all those cases. So that 787 number captured everything reported to us. That number does not capture people who have taken an at-home test, maybe called their local board or called the school to say, hey, I'm positive, I tried to test them safely. Those numbers don't come to us. There's really not a means for at-home results to get incorporated into the state data. So that's across the board as well, if you're looking at the state's dashboard. So the 787 cases we've seen in the last 30 days, that compares to the previous 1 month period or 30-day period was 238. So huge jump, obviously well over double our numbers that we were a month ago. So we're in clearly the Omicron surge that we're seeing statewide. And then compared to last year, where were we? Because we did have sort of our peak around the same time last year. In comparison, from the 10th of December to the 10th of January, there were 316 cases. So we're quite a bit over double where we were last year on those case counts. And this graphic and below, this is showing the total number of cases reported in a single day. So that's why you always see, like, if you see the state graphics, like numbers don't come in on a weekend because test centers aren't open. But you can see in the last week or so, we've seen over 100 cases come through the Northborough Board of Health. And just, people want to know, how is this impacting our schools, or really where are the numbers of the trends? So I'll talk a little bit more about our update on staffing and contact tracing, but I'd like to credit our new epidemiologist that was hired by the town part-time who put these graphics together in this very busy week. So thank you to Isabella Caruso, our 19-hour week epidemiologist for the greater boroughs that put this slide together. So between this same 30-day period, the 10th of December to 10th of January, we've seen 104 positive cases in young children ages 0 to 9. About twice that amount, or 184 in kids ages 10 to 19. So, the high school, if you're following it, we're seeing a lot of cases in those age categories. And then we sort of drop off. So, there are other times where, our kids weren't in school and we weren't seeing cases among kids, and now we are. Just because of the nature of the kids in close contact, and the Omicron is obviously much more contagious. But I can assure you our schools have been working hard and making modifications as well. So we not all of these are attributed to in-school transmission or anything. We're just seeing cases high across all age categories, but specifically in our 10 to 19 is our biggest category right now in the last 30 days. So anyway, there are updates on our case count. And for this reason, the Board of Health held a meeting on last Thursday on January 6th to review this recent surge in case counts. The Board of Health did vote 4-1 in favor of a townwide mask mandate due to the rising caseload and the test positivity rates. So this mask mandate is available on the website. It was effective or became effective at 12:01 a.m. So today, face coverings are required in all public indoor places. They have to cover the nose and the mouth, and they're required of all individuals, regardless of vaccination status, age 2 years and above. This includes restaurant, retail establishments, bars, performance venues, social clubs, healthcare facilities, gyms, etc., places of worship. So this is a change. It's important to note that all businesses must post this notice or a sign advising customers that face coverings are required in the establishment. And the Board of Health will review the mandate at their next meeting on February 8th. So it's not something the board, plans to keep in place endlessly. It's something that they're going to look to review month to month meetings. And if we need to meet more frequently or before our next regularly scheduled meeting, we'll do so. So again, here's just a picture to the right, which is a sign that was distributed to our businesses post. It does note that there are some, possible exemptions for disabilities or medical conditions, but it's all outlined in the full regulation, which is available on the website. I want you all to know that this was circulated through our constant contact email distribution list. It was also, this morning we did another reach out to all of our businesses if there were any new ones that we may have missed in this weekend's update, and they should all be informed, or they will be informed in the near future. So we're going to work with businesses. We know this really came about very quickly. We want to be a partner, and overall we've had pretty positive feedback. We had some great food establishments that reached out to say, hey, we've been doing this all along. There's obviously exceptions that if you're seated and eating or drinking in a food establishment, you could take your mask off. So there's some of the common sense things in there. And I think the hardest business that we found last time around, and we're hearing again, is just gyms and indoor fitness centers. It is still required to wear a mask. There's no exception in the mandate for if people can distance 10 feet or 12 feet. And this mandate and the language that is incorporated into it, is in line with our surrounding communities. Southborough passed a very similar mandate this morning. Westborough passed it, I believe it was last Monday or Tuesday, as well as Grafton. Shrewsbury has a mandate in place. West Boylston has a mandate in place. Worcester has a mandate in place. So we are not alone in this approach, and it's definitely in response to this existing surge that we're hoping, according to the news, is going to be short-lived. We're seeing like England and other countries that have had a similar surge has dropped off. So this is a temporary mandate, and it will be reviewed at the next Board of Health meeting or sooner.
Kristen, if I can interrupt you through the chair, can you just make a comment about the cloth masks and the effectiveness against this particular variant? We're trying to get people to use not just masks, but use the effective masks.
Right. So I think that's a great point. We really want people to be wearing better quality masks. I know in the summer, right, like our numbers were really low and people were comfortable and it was hot, and you might have got really comfortable in that really good old cloth mask and you love it now because it's all worn in and it feels great and you can breathe easily through it. But really, this is the time. If we're ever going to really lock it down and do everything we can, it's the next 3 weeks. And so it's really advising people that the KN95, so N95 is our best standard. We used to always say, hey, those are reserved for only healthcare, but they are more available on the market. They've been ramping up supply. So people can buy N95s on Amazon or other places. KN95s are sort of our next down, and those have, again, the metal clip around the nose. Those are very available. Those are sort of what we recommend. They're a little more comfortable than an N95. Surgical or sort of next and cloth. If you're wearing a cloth mask, it really needs to be 2 layers. It needs to fit well, and you need to launder it regularly. And so it's something to keep in mind. We do want a good fitting mask. If there's large gaps, people wear a surgical mask all the time and they think they're doing the right thing and they never pinch it around their nose. And then if you look, they get a good 1-inch air gap and it's not doing it. So it's about a well-fitting mask for individuals who are even layering masks. So if you have that cloth mask you really like and a surgical doesn't fit you well, putting the cloth mask over a surgical mask is really a great way to go. So we want a mask that fits well is really what's important right now. So any other questions on the mask mandate?
Board members, I'm sorry, I can't see everybody. I did see Leslie raise her hand.
Yeah, just curious. I was actually looking on Amazon, in fact, for masks, and you get this list of masks that are NIOSH certified and blah, blah, blah. Is that important? Can I just get any KN95, for example? Does it matter?
It's tough. There's just so many products out there, and especially the Amazon marketplace, like I don't know the integrity of every seller. So I would just say do your research, look for reviews. NIOSH is just a standard, that certifies different mass. So that is a level. So if you're seeing it, that's probably a good thing. And just really looking at those reviews, I would say it would hopefully be helpful for you. But the KN95 sort of fits the category. The N95 is a whole nother category, and there's a whole range of manufacturers in that. And so I would recommend if you never ordered from that group, maybe just buy 5. Don't buy 100. You might not like them. They're not all created equal. I talk to people all the time that say, hey, I purchased them. They were great. And then I got them from this other company. I hated them. And, so really talk to your friends. If somebody has a mask that you like, can you have one and where did they buy it? And just really finding the right fit for you.
Right. Thank you.
Board members, any other questions? Kind of flipping back and forth here so that I see everybody. I don't see any other questions.
Okay.
A couple things, Chris, I guess I just want to clarify up to this point, it's often been the case you see signs posted where an establishment requests a mask be worn if you're not vaccinated, for instance. And now we're saying that's no longer an exception. Everyone should be wearing a mask going in and out of these establishments, whether you're vaccinated or not, right?
Correct.
Yeah.
Yeah. And unfortunately, and I think, with the vaccination status, there's no way to police it, and also we have a lot of people now that can get out of isolation early, right? There's that 5-day versus 10-day, but you must strictly wear a mask when around others from day 5 through 10. And we're also seeing if you've had an exposure in certain circumstances, let's say you're fully vaccinated and you've had a close contact exposure, you would be recommended to wear the mask around others for the full 10 days. So again, I think it's important that everyone is wearing masks. There's no way to be the mask police for individual people in that setting. And we're seeing breakthrough cases, right? We talked about that 4 months ago, 5 months ago, and we're seeing people, that have, had an infection, 120 days ago and now have a new infection. So it's just, unfortunately, you're going to have less serious illness, but you do still have the ability, even if you're fully vaccinated, to transmit it to others. And you could be asymptomatic. So it's important that everyone's adhering fully to the guidance for, getting through this current wave that we've really never seen before.
Great, thank you. One more request for questions. I don't see any hands up. John, do you have anything you'd like to add?
Nope. Are you, I'm not sure. Are you complete with your slides, Kristen, at this point?
Nope, I have a few more. I just know the
Got a
mask
couple.
mandates.
Sorry.
No, the mask mandate's such a big topic. I just wanted to pause while I had
Right.
it up on the screen because, there has been some confusion. What if they're vaccinated, whatever. And there will continue to be confusion for individuals as they may have businesses in multiple towns. The rules are a little differently. So we're here to partner with our businesses. We want to do, the right thing to protect their employees, our residents, anyone coming to Northborough to do business. And so we're happy to work with businesses for clarification. And I would just recommend that individuals reach out to the Board of Health. So just to move on with our COVID-19 testing in our area, unfortunately across the state, we're seeing, limited access to PCR testing. Or it's out there, but you got to get it just right. So I'm going to walk you through our 3 local test sites, that are we've been typically referring people to. Please ignore that typo after Monday. But for the most part, New England Sports Center in Marlborough has been really a great resource in our community. Their staff is extremely well organized. We're sending a lot of people over there to get a PCR test, and that's available Monday to Friday from 8 to 12, according to the posted hours on the website. But if you've seen anyone or talked to anybody, you may have heard of people getting turned away. And so what's happening is I believe the traffic's building sometime around 8:30. Individuals waiting in line may be asked to leave and told that there's no additional testing. And then I hear rumors that other cars get through, the traffic eases up, and and then they'll do more testing, and then people are definitely getting turned away after 10 a.m. So I recommend if people need testing and they'd like to go to the New England Sports Center, you need to get there either really early, like I hear people get there as early as 6:30 for 8 a.m. appointments starting, or try to avoid that wave at 8 a.m. when everybody shows up and there's a backlog for the last hour and a half. So it's either, I think, head there at 6:30, 6:45, or go there for 9 o'clock. And people are getting in, but what I'm hearing is that they're running out of test kits, before the 12 o'clock, and they just don't have enough test kits to administer. We're also hearing a slight delay, that it's not always the 24 hours, might be creeping closer to the 45. They've always said 36 to 48. They've just been excelling, but we have the recent surge. So it's going to take a little longer to get a test. The Ashland MBTA station has now gone to appointment only. So before that was a drive-through, no appointment needed site. Unfortunately, you do need to book an appointment. I know last week they were at least a week out in booking those appointments. Project Beacon in Framingham has always been by appointment. That's still there. There's also the Mercantile Center in Worcester, which has done a great job. But all of these test sites and more are listed on our tinyurl.com/nborough testing. And so there's, the state has a website where you can search for available tests. But what we're hearing most of our residents are relying on are these new at-home antigen tests, right? You can pick them up in any local pharmacy. Stores are selling them. People are rushing to get them. If you listen to the news, they'll tell you exactly when the CVS drop-off takes place, and you better get to the store then and buy them for your friends. And so it's hard. The antigen kits are sort of like flying off the shelves, and you're lucky to find them at times. We're hoping that's going to improve. But I just want to caution the public that these antigen test kits are proving not totally accurate in detecting the new Omicron. What we're hearing is that early in someone's infection, they may appear negative, and then their symptoms, continue, and they get a test on day 3, and oops, fate, I actually was positive, but my test 3 days ago didn't show it. We're seeing some of this firsthand in our municipal testing program. And, you're reading about in the news, CDC has, released statements about this. So I think it's just really important we note to the public. If you're sick, stay home. Even if you're feeling sick and you've had a known exposure, even if that antigen kit says negative, you may want to try again or go seek that PCR testing. So either multiple days on antigen or going for a confirmatory PCR. However, I would say if you have an at-home antigen test kit that says you are positive, it's probably right. It's like 99 point, something percent accurate. And so we don't see the false antigen. So a lot of people are taking that at-home antigen. It says they're positive. And then before, we used to tell you, go confirm it with a PCR, right? We don't have that many PCR testing available. We're sort of at the surge capacity. So if it's a positive antigen, take a picture with your phone next to it so you have a timestamp and a date and go with that. Most employers are accepting that. If you have a child who's test home with an at-home kit positive, most of the time the pediatrician's offices now are saying, that's positive, we're not bringing you in, stay home, here are your guidelines. So it's important to, we're sort of changing how we use those kits. So the schools are accepting them now, but we want everyone to be aware early in the infection, they are not always detecting COVID-19. And so the other thing where we've had some confusion from the public is, you may have heard, I might have mentioned this at my previous visit for you, that the state did distribute free test kits to 102 communities. Northborough was not selected. It was based off of poverty level. The state is not doing any additional distributions. However, the state did go through a process, state bid process through combis where they're offering, through combis, which is where we can purchase items from the state at pre-negotiated rates and meet procurement law, the purchasing of at-home test kits. But there is no free federal dollars we can use for distribution to the general public. ARPA is a possibility, but obviously ARPA funds are widespread, can be used for many things. So right now, the Northborough Health Department, I'm working with the fire department in town. I've had conversations with Westborough and Southborough. We're likely going to seek Metro West Health Foundation funds in the amount of $50,000 per community. That would allow for us to purchase those at-home test kits at the discounted rate through the state bid process. So we need you all to be patient. I wish we could have them tomorrow, but it's not too far off for $50,000 in grant funding to support that of distribution of free at-home kits, and we're pursuing that option. I was on the phone today with the Metro West Health Foundation grant coordinator for this particular grant, and they did say that was an eligible cost, and the money is really allocated. It needs to get officially approved by the board, and we can't purchase kits until that's approved, but it's not too far off. I wish it was sooner, but it's a great opportunity for Northborough, and we're seeing what we can do. So there is still the testing options, and we'll be hopefully coming to you with more information about availability of at-home testing. I'm going to briefly cover some upcoming clinics. CDC, as of last week, they updated their recommendation on boosters to now include everyone 2 years of age of older, which, before it was just 16 and older. We went through that wave. Now it's all the way down to 12 and older. And the duration of the time between your last shot and a booster has been shortened to 5 months. So a lot of people may have 12-year-olds, 13-year-olds at home that said, oh, I'm not even at the 6-month mark. I'm not eligible yet. No, you are. It's now 5 months. And that's moved for everybody. So not just for that younger 12 to 15 age category. So everyone 12 years of age and older, and at least 5 months out from their second dose of their primary series of Pfizer and Moderna is eligible. So again, the younger age group, the 12 to 17, can only have Pfizer. So we're mostly holding Pfizer clinics. We'll be doing them the next 3 Tuesdays at the Northborough Senior Center. They've been a great partner. We are partnering with Northborough and Southborough health departments, as well as the Boylston, Northborough, Southborough Fire, to support these with staffing. Our local MRCs are carrying the huge, the lion's share of our staffing and our vaccinators, and they've really come through. So a big thanks to all of our volunteers, our school nurses, et cetera, that are helping us to run these clinics, and our own health department staff to pull these all together. And so again, it's going to be Tuesday. The link here is live. There's plenty of appointments. I think I have 70 available tomorrow and about 300 each following Tuesday. And then we do have both Pfizer and Moderna available on Friday, and we'll continue to meet the need of the community and add additional clinics as needed. So again, both of those links are there. They're on the website under Town News. And also, if you just want to see the list of current clinics, we did make a tiny URL. So it's tinyurl.com/nboro, NBORO VAX clinics. So again, that link is here on the screen, and all of this information is on the town's website. There's a particular page associated to our upcoming clinic. And lastly, just a brief update on our contact tracing of COVID-19 cases. So as you may remember, the board approved the acceptance of grant funds in the amount of $160,000 a year. We acted quickly, and Northborough hired a 19-hour-a-week epidemiologist named Isabella Caruso, who just started last week. So thank you to John's office and Becca and everybody for making that happen in lightning speed and municipal scope of things. Also, the Greater Boroughs Partnership for Health Advisory Board approved Sam and DNA for an additional contract, hiring 2 part-time or 24-hour per week nurses. And they've been brought on and are fully trained in providing contact tracing support. And then just last week, DPH, the Department of Public Health, really changed the scope of our grant award that we previously came, and they sort of pulled it back. Originally, it said do 100% of contact tracing. And at 500 active cases right now, DPH understands no Board of Health can really keep up with that. So they really scaled it back, and the scope is focused mostly on our highest risk populations, congregate settings, et cetera. So we're really focusing our efforts, making phone calls, working with the schools in the ages of that, like 0, daycare, young children, most likely in a congregate, in a setting, a school setting, all the way up through the high school at grade 12. So we're really focusing our effort on reaching out to those age categories 0 through 18, and also our seniors. So anybody 65 and older. And what the state is directing us to keep up with the surge is that, individuals should be directed towards, the state's website with the guidelines, but we answer questions all day, every day. We have a staff, and if residents are confused about what they're supposed to do, or what's their day 0, and how do I get to 10, and what about my partner who's at home with me, and when do they start? We're here to support you, and we should be able to return a call within 24 hours on a regular business day. So please reach out to the Board of Health. So we're changing our contact tracing a little bit, just like everybody across the state, and we're really trying to focus on those 2 age categories. So I think that's all I have for slides. I'm going to stop my share, and I'm happy to take any questions you may have.
Great. Thank you very much, Kristen. We really appreciate the update. Certainly a lot going on, and a lot of activity, and a lot of things to keep track of. So just very reassured that we have the right people in place to do all this work and coordinate it properly. So thank you. Kristen Wickstead.
Hi, thanks, Kristen. So it's my understanding that with so many people testing positive, if you hadn't got your booster shot before, is the rule still that you have to wait 90 days from when you test positive? What was the rule again?
Yeah, no, that's a great question. You remember correctly, very early on in the approval process of the vaccines when they first came out, They said, don't get a vaccine if you're within 90 days of infection, and don't get a vaccine if you've got any other shot in 14 days. That was all lifted, I don't know, at least back to March. So now the rule is, you can't get a shot if you're in isolation, stay home. But outside of that window, even individuals who are close contacts, as long as they're asymptomatic and they're set to be out in public, even if they have to strictly wear a mask, it's pretty lenient. If you can be out in public, you can go get a shot, right? But if you're symptomatic, it's not recommended. Even if you're not sure what you have, but I'm not feeling good, don't come get a shot if you're under the weather. We're happy to reschedule you, but there is no requirement of 90 days. I know people on day 11 after they've completed their isolation that just want to get out and get the shot done. And so I think you have a lot of flexibility there, and we don't have that 90-day limitation anymore.
Okay, great. Thanks.
You're welcome.
Leslie.
Yeah, Kristen, yeah, thank you very much. You really did add a lot of information in a short period of time. Very impressive. Question for you about the at-home test kits. If we are given X number of those, how do you envision those being distributed or picked up? What are other communities doing who have been given an allotment of those?
Right. No, great question. We're closely following what other communities are doing. We want to be equitable. We want to try to obviously help our neediest community that maybe not be able to afford or get to testing. So some ideas that I've heard of in other communities that I find interesting, that at the end of the day, I think we'll be making a task force in town if we were to receive kits and really working together with multiple department heads. But some of the ideas I found interesting, distributing kits to affordable housing, or housing complexes in town, have them readily available at the senior center for our seniors, distributing them through Meals on Wheels program, also distributing them through the schools. So maybe not, I've heard everything from every kid with a backpack gets one, right? And they just send them out, but those would go very quickly. And so what we've also heard that sounds helpful, and I talked to Mary Ellen Duggan, our school wellness coordinator, today about this possible idea, is if we have a student who is going home and maybe they had a positive antigen test result, either at the school's, testing program, or either they went into the nurse with a scratchy throat. If that student ends up positive, and they have 3 family members, can we put 3 kits in their backpack so everybody else can figure out very quickly, if they currently have an active infection? So lots of ideas. I mean, other communities like Uxbridge just, received the free kits from the state, and they just said, everybody come however you come, and just come to these sites. So we're definitely listening closely to surrounding communities of what's working well. I think it's really going to depend on the availability of the testing. These kits for purchase range everywhere from $5 a kit to $26 a kit. So if the $5 a kit are gone by the time we're ready to order, we might have half of or a third of what we thought we could actually get. So I think we're really going to look at the number. We're going to maybe even, work with our task force, even work with local churches and communities. I've heard of, people really bringing the community together in these focus groups to figure out how do we get it to our residents most in need. I mean, ideally, I'd love to give one to everybody. I'd love to give 5 to everybody because one doesn't go too far, but I think we'll have to work as a team, with town departments to make the best decision for our community and individuals really in need. We have a fabulous community here. So such a great network of support that if individuals are reaching out and are in need, we'll find a way.
Mm-hmm. Wonderful. Sounds wonderful. Thank you.
You're welcome.
John, would you like to offer?
Yeah, I just, in many ways, we are back to April of, 2020. And in fact, the numbers, as you saw from the graph that Kristen shared, are way higher than anything we saw when the governor shut the entire economy down. The difference being we know more than we knew back then, more people are vaccinated, and we've had a number of protocols we've put in place. But this is having an impact on all our organization at every level. We have folks that are out. We have, in many cases, family members that are home quarantined because, or staff members quarantined because their children or family members have contracted it. So at this point, our buildings are open. We very strongly encourage people, if there's something you need, probably 98% of things that you would come to town hall for can be done remotely. So you don't need to come in, but if you do come in, you're required to wear a mask. We have retrofitted all of our all the doorways in the town hall with service windows to provide additional safety for residents and for staff. And then we also have, in terms of some of the programs that we've run, we've moved anything that we can that can't be done with safe social distancing. We have moved back to remote. Boards and committees are no longer going to be allowed, at least for the coming weeks, to meet in person. Everything is back to Zoom. There were a couple of smaller boards and committees that were meeting in person. We don't feel that we can, we want to be accommodating that. It's not a best practice. And then last but not least, we have reconvened beginning last week our COVID task force, which involves all key department heads, social services, and the school department, so that we're all aware of what's happening. We're all sharing information, and we're all making sure that the departments and the staff at every level is on the same page as to what we're doing and why we're doing it. So again, a tremendous burden on the organization and the community. Kristen's done a great job, as always, keeping us out on the cutting edge of everything. But it's been COVID all day, every day for the past week and or so, and I anticipate the next several weeks it's going to be the same. So if you try to catch somebody in person, we've got a few departments, because some of our departments are only 2 people, and we can't afford to have both of them out sick. So we have implemented our continuity of operation plan in a limited number of departments where we've got people so they're not working together at the same time. That may get expanded and to other departments depending on how things proceed. But again, we are in a much better shape now than we were before, based on the physical modifications we've made to our buildings, the technology that we've added, the new phone system that allows us to forward calls and allows people to answer their office phones remotely. So all of that stuff is in place now that wasn't before. But I think it's important for the board to know, and I hope that you appreciate the impact that it's having on our organization, because not only do we have to keep our services going, but these are the critical services like the Board of Health that the residents and public safety, the residents are relying on. So it's important and critical that we stay operational. So we're taking all the necessary precautions and steps to do that, but it's going to become increasingly more difficult over the coming weeks. And again, both the public and the board understanding of the situation is important for staff. So I appreciate it. And if you have any questions about the services or the hours or anything like that, by all means, we're happy to, please give me a call, happy to talk about it. And if residents have any difficulty or need accommodations, they need to do something in person and they have concerns, they can contact the department. We do have some ability to make some accommodations for folks in a limited capacity. So again, we're here to serve, and we will continue to serve. It's just going to be a little bit creative over the next few weeks to get through what is clearly the largest surge of the pandemic thus far. So, thank you.
Thank you, John. We certainly appreciate the efforts to try to keep town services running. Town staff are not immune, no pun intended, from the effects of this. And certainly there's some impact to town operations, as well as every other aspect of life that we experience. So we certainly appreciate the effort. Kristen, I had one more question. I saw the information today that the mass.gov website now has a mechanism set up to get an electronic copy of one's vaccination status. Do you know anything about that, or do you have any suggestions relating to that?
So yeah, I just saw that too. I haven't heard about it. Our weekly DPH call takes place on Tuesday, so I'll probably know a lot more tomorrow by 4 p.m. I would say for now, what we've been fortunate to do in Northborough, having a full health department staff, or at least a few of us, we can make vaccination cards for individuals. So because we have access to the state's MIIS, or where all the immunizations are. Someone right now, even if a resident has, lost, stolen, washed, we've heard all of it. You can call the local health department. We'll verify your mailing address, your name, your phone number, and we can make those cards for you. Simple and pop it in the mail. But I look forward to hearing more about the state's program and hopefully more to come. So we've had a local solution to that so far. And I think I'll be able to report more as of tomorrow.
I've already signed on for the electronic version, so I'll let you know I hadn't received any response yet back, but I already signed up for it just to see how it worked.
Very good. Thank you. Any other questions? Yes, Kristen.
Jason, thank you. While you were talking, it popped up on my computer screen that my sister just literally did it 2 seconds ago. It was really funny you asked, Jason. So I was like,
I'm keeping more things in my electronic wallet lately, and I
Yeah.
think I have another card to enter now.
I think it's a good idea. And Kristen, on the town website, I was just gonna double check with you. You said that all your tiny URLs and the clinics and all your information is up there. So what's the easiest way for people to get there?
Yeah. So if you go to the town's website, I think the banner is back up, a red banner. If it's not, across the header, you can see like town, calendars, boards, committee. The far right tab says COVID-19. So if you click on that COVID-19, you can see everything from like guidance to isolation, testing, mask mandate. So sort of everything COVID related is going to be found on that one landing page.
Yeah.
Got it.
Through the chair, like I said, it's like Groundhog Day again. The COVID banner, emergency banner that we had across the website, we took it down a while back, and we've put it back up. So if you just get to the town's website, town.northborough.ma.us, just click on the banner, it'll get you at everything Kristen's talked about.
Very good.
Thank you.
Kristen, thank you once again for a comprehensive update, and I have no doubt we will be seeing you once again in the future.
Okay, it's always a pleasure, and don't hesitate to reach out to the health department directly. So thanks again for seeing you all. Stay safe.
You
Great.
too.
Take care.
Thanks, Kristen.
Now past the hour of 7:10 p.m. and we have Scott Charpentier, Director of Public Works, discussion and adoption of a complete streets policy. I'll note that for this particular agenda item, we will be accepting public comment after the presentation, if anyone is so inclined. So Scott, why don't you proceed?
Thank you, Mr. Chairman. I'm here tonight to talk about the Complete Streets program. It's a Mass DOT program. There is a memorandum in your package that kind of summarizes how the town goes about becoming a complete streets community. It's a tiered process. The first tier is relatively simple. We go through some training, and our town engineer, Fred Litchfield, went through the complete streets training as I did years ago. Fred did it recently to get the updated protocols. The next step is the governing body, yourself, the Board of Selectmen, to consider and adopt a complete streets policy. And the last tier is to develop and adopt a prioritization plan. The Complete Streets Prioritization Plan is identifies multimodal communication, transportation throughout the community, bicycles, pedestrians, gaps in the intermodal transportation modes. And after that, we're eligible for grants. So what we're here to talk about tonight is the Complete Streets Policy, which is the first piece. This has been developed in conjunction with our consultant, Wood & Curran. It's a policy that's based on a similar policy that's been adopted by other communities. It checks off a lot of the boxes required by Mass DOT. So Mass DOT, after consideration and adoption by the Board of Selectmen of the policy is submitted to Mass DOT for acceptance. They review it, they grade it. As long as it reaches and achieves the required 80 point grade, it's an accepted policy, after which the prioritization plan is developed. We have an opportunity to submit for a grant to help us fund the prioritization plan, which includes consideration of a lot of elements of the Complete Streets program. The prioritization plan will marry itself to our sidewalk management plan, in identifying gaps in our sidewalks for pedestrians, bicycle interconnectivity between our destinations and the neighboring communities, such as the bicycle lanes on Bartlett Street and other corridors. And it allows us an opportunity to map out a funding mechanism going forward. So the prioritization plan is really where the meats and potatoes come forward. The policy we're talking about tonight is what allows us to develop that plan. So the policy itself is identified in the master plan. Actually, the entire tier 1 goals in the transportation section of the master plan, all of those are complete streets pieces. So our objective here is to adopt a policy that engages all of our roadway projects to implement complete streets policies. The idea is that when there's an opportunity to allow pedestrian improvements as part of our roadway management plan, or as part of the planning board's subdivision approvals, we have a mechanism to implement that. This includes things like as simple as a wheelchair ramp improvement at an intersection because we're doing a roadway improvement by it, to more extensive improvements such as a sidewalk reconstruction along a roadway where we're doing full depth reclamation. So the sidewalks can be accommodating for pedestrians, wheelchairs, baby strollers, and in the event there's adequate right-of-way, to also incorporate bicycle lanes and shared lanes. So the complete streets policy you guys have and the memorandum outlines what we're looking to consider tonight. The roadway management plan we have incorporates a variety of treatments, and one treatment that has been not incorporated over the past few years has been sidewalk improvements. So, our goal as the Public Works, working with the Master Plan Implementation Committee, is to bring the sidewalks into our roadway management plan. And how we do that is through the complete streets policy. The adoption of it, again, allows us to get a grant for a prioritization plan, which ultimately, once the prioritization plan is adopted, approved by Mass DOT, makes us eligible for up to $400,000 worth of grant funds for sidewalk improvements. The goal and objective of those grants is to close gaps. We've identified many gaps in front of this board. There's a sidewalk gap on Maple Street. We know that between Ridge Road and the high school. There are gaps along Allen Street and Davis Street. There are many locations in town where pedestrian and bicycle improvements can be implemented. Part of the process of doing that is the Complete Streets program, adopting the policy, and ultimately the prioritization plan. One important thing to understand is this is only the first step. This is just the policy. The prioritization plan is where public involvement really gets engaged. That's where we have charrettes, where we have our consultant work with us about destinations, which are schools, recreational facilities, and portals where people are coming from, neighborhoods, Northgate, that want to get to the different recreational areas. That's where things come together in the prioritization plan, and that's where a lot of public engagement occurs. So we're hopeful that the policy can be adopted and the prioritization plan can be developed. The schedule going forward marries itself well with our sidewalk management plan. Our pavement management consultant has been working on a sidewalk management plan, which is more geared toward updating and upgrading our current sidewalks in concert with our roadway improvements. And that is scheduled to be completed in the next few months. If we can get this adopted and the prioritization plan developed over the coming seasons of the summer and the fall, next construction season, I'm hopeful that we can have some grant money from the Mass DOT to bring those two things together and really, enhance sidewalk, pedestrian and bicycle connectivity between our recreational facilities and schools and our neighborhoods. So it's a priority and a goal in our master plan, and I'm hopeful that we can adopt this and seek grant funding from the state to bring both things together. That's my objective.
Thank you, Scott. Just to clarify, as you said, there are 3 stages. The first one is this policy. The second one would be the prioritization plan, which would be much more detailed and specific in terms of projects that it might identify. And by getting the policy accepted, you're saying that makes us eligible for grant money that could be used to develop the prioritization plan?
Yes, that's correct, Mr. Chairman.
Okay.
The adoption of the policy by this board and then the acceptance of it by Mass DOT allows us eligibility to grant fund the prioritization plan. Grant funding through that plan will help us really engage the community on where the needs are for bicycles and pedestrian improvements. Once that prioritization plan is developed and accepted by Mass DOT, we're then eligible for up to $400,000 worth of grant money. That could be one project for $400,000. That could be 10 projects for $40,000 each. The key component of that is that it allows us as a public works and a community to bring multimodal transportation into all of our roadway projects where it's appropriate. And by where it's appropriate, I mean between schools, recreational facilities, neighborhoods, and commercial areas. It's critical, and it's needed for me to have that kind of community guidance on where the improvements are wanted to be made.
Very good. Thank you, Scott. John?
Yeah,
Yes.
I'd just like to add a couple of points before we get into too much discussion. One, I just can't stress enough that pursuing the complete streets is part of an outgrowth of the master plan and the master plan implementation committee, focusing on walkability and multi-modal disciplines or avenues of transportation. That is a goal and a priority of the community. So moving forward, what you heard Scott Charpentier outline is this process is to make sure that we're looking at this holistically as a community and not just one particular neighborhood or one particular project or issue, but to look at it holistically and have a good process. So as always, you heard me say, it's important to have good information and a good process so that you're going to have a good outcome. I also just want to stress, this is all great stuff. But be clear that, having the plan in place is going to be great, and having access to $400,000 of grant funding is also great. It's not a lot of money in the grand scheme of things. We put $1.1 million every year into our roadways. That's just to maintain things where they are. The other component of this is going to be putting a funding plan together for how we go about implementing this plan. And the grant funds are not going to be the answer. They're a piece of it that will be helpful. And it's great that we can participate in that program. But anytime you're following complete streets, you can see the cost of doing these roadways can escalate, 25 or 30%. The outcome is a good thing, and it's what you want. But we want to have a holistic approach, and then we're going to have to marry it with a realistic funding source. so that we can then put it on a schedule for implementation. I mean, that's the classic approach of our capital improvement plan, which is our 6-year plan. So within the capital improvement plan, we're going to need to work in there a recurring appropriation of some kind, either from the tax base, from free cash, wherever, potentially some grant funding, and to make that recurring, just like every year we have as part of the budget process. There's $1.1 million in funding for roadways. We also know that funding amount is inadequate, so we are desperately in need of additional transportation funds. Historically, it's been a number one legislative priority for this board for the past 3 or 4 years. It's been in the top 3 for the past 10 years of additional Chapter 90 funds, which are transportation funds from the state, or additional grant funding. Now, a couple of things that are happening out there that you're aware of. There is going to be there was a $1.3 trillion infrastructure and transportation bill that was passed at the federal level. We're seeing that money has to flow through the states, and before that gets to us. We're hoping that a lot of these programs, including the Complete Streets program, as well as potentially Chapter 90, small bridges, and a number of other programs, that we're going to see funding flow in through there. And so our timing in the process that Scott Charpentier has outlined should put us right in a good place to take advantage of those funds as they become available. But again, it's about a comprehensive approach based on a priority and a goal that's laid out in the master plan, which in turn was based on a significant amount of public outreach and input and focus groups. So this is how we get, again, good information, a good process, and then we need to come up with the funding. So in order for us to take that grant component through Complete Streets and use it as a guide for how best to redevelop our streets and to make improvements, it's necessary that you guys adopt this policy. So as Scott said, it's really the first step, but it's the first step of this prong of a multi-pronged approach to roadways, sidewalks, walkability, all the things that we talked about being priorities in the master plan. And the master plan implementation committee has identified already as the top priorities that they would like to see the administration working on. So that's why we're doing what we're doing right now. And that's why this is before you this evening. So.
Thank you, John. Board members, yes, Leslie.
Okay, first of all, based on what I'm seeing and what Scott and John are saying, it sounds certainly like something we should adopt. Devil's advocate here, are there any limitations to this program? Have any other communities experienced any difficulties in working with this particular policy?
I'm going to just chime in. The biggest issue is going to be cost. That in order to develop roadways and sidewalks to this level, it just costs more money. It's a good thing, but it costs more money. That is the number one drawback. And that's why the state has the grant program to help incentivize you to do that, because they want to see this type of sidewalk and multimodal transportation options for us. But it like everything, they're incentivizing it, but they're not going to cover the whole cost. So it's going to be in part up to us as a community, if this is in fact a priority, to figure out how we're going to make it a sustainable priority. This is not one of these, you get $400,000 grant to do something and you're done. This is a recurring, this is a multi-million-dollar initiative that will be over years and years and years moving forward. So again, it's about the town saying this is a priority for us, and then us as staff coming up with the best way to go about accomplishing that priority in the most cost-effective way. But the downside, if there is a downside, is just it's going to cost more money to develop, the same roadway or the same streets because it's being done to a higher level. Does that make sense?
Yeah, John, you're absolutely correct. It's the $400,000 grant is fantastic. It allows us to address some needs that we have identified, connectivity gaps. It's the roadway management plan going forward beyond that where the costs get incurred, and the cost to implement Complete Streets on a roadway management plan can be 20% on top of what we're already doing. So going forward, it's costly, but it's a cost that I think is warranted because the community has identified it as a need. So it needs to be factored in, as John indicated.
I think through the chair, the most difficult thing for us is going to be identifying, it's going to be a annual recurring cost for us if this is a priority. So it's going to be, we're going to have to identify a recurring revenue source. It could be taxes, it could be some amount of free cash, it can be grants, but or a combination of the above, more than likely. But we're really going to need to identify through our capital improvement plan a recurring revenue source. Just like every year in the capital improvement plan, there's $300,000 that comes out of available funds every year that goes to roadway. I think you're going to see ultimately, a set number based on the priorities and the plan that we agree on. What's going to be needed as an annual appropriation to move us in the direction of achieving that plan and those goals. And so that's going to be the more challenging, identifying needs and things we'd like to do. I think that's good. That's the fun part of the process. Trying to figure out how we're going to pay for it, or coming up with a plan for how we're going to pay for it could be a little bit more challenging. And people need to be aware that grants are out there, but it's ultimately the town is going to bear a significant portion of the cost to do that.
Scott Rogers.
Yeah, John, I think you just covered my question, because in my mind, I was thinking of those sources. And so if we're an example of we're allocating $300,000 from free cash to roadway improvements each year as a capital expense, we probably see that go to 400, 450, something like that. That am I right in thinking that one avenue is increasing the allocation from free cash?
Through the chair, one of the things that we do with the pavement management plan is once you have all the information, we're actually able to show you what our pavement condition index, the score of our overall score of our roadways on a scale of 0 to 100. We can tell you, if you give us X dollars, what your index is going to be in 5 years. Is it going to improve, stay the same, or get worse? And so ultimately, that's the type of information that policy decisions are made upon, which is, I don't know what that number is sitting here right now, Scott, because I don't know what all the needs are, and we don't have a plan in place at the moment. But that's when you start marrying all the data together, and that number may be another $500,000 a year that needs to be done through either taxes or a bond issuance is another way that some towns have done it. Again, it ultimately will be paid for through financing, which would be tax dollars. The good thing about this is, this is the first step in opening the door to some potential recurring, grant funds. And as you see these money flowing from the feds through the state, we want to position ourselves to take advantage of as much of that potential infrastructure funding as we can. I think you're going to see in the next couple of years is going to be a flush of potential infrastructure grant funding based on the federal bills that were passed and some of the things that the state has done. We don't really know where it is yet. That $1.2, $1.3 trillion infrastructure bill, nobody knows what that looks like yet, because it has to flow through the states. Then the states will determine, are they going to funnel it through existing programs in grant programs that they have, or are they going to create new grant programs or new programs in general? So that all remains to be seen. So it's going to be a little while before we see that funding. But my hope would be that first and foremost, the state will fund programs like Complete Streets and Chapter 90 and some other things that are already on the books that we're all used to. Green Communities is another program that we participate in. And that essentially they'll fund those programs, and then they may create some new ones in addition to that. But it remains to be seen, and we want to be able to position ourselves to take advantage of those monies when they become available.
Yeah, I think that's my takeaway from all this, is that we want to put ourselves in a position to be able to work with these. So starting with this policy is the right step forward so that we're eligible for these grants and other prioritization plans. All right, thank you.
Kristen.
Hi, thanks. So, thanks, Scott. So I was reading your roadmap, the document in our packet that is green, and there's just some wording that I wanted to make sure I understand. So one of the terms you use a lot is stakeholders, like in July 2022, number 11, the italicized part says include sidewalk and field evaluation of online public survey and workshop for stakeholders to obtain feedback. So can you just run past me what that means? Who are the stakeholders? And
Sure. Through the chair, stakeholders would be, anybody who is involved in the destination location. So, the school department, the recreation department. If there's regional or local athletic folks, the baseball, soccer, the Friends of the Seniors, things like that. Stakeholders. If there's active members of the community who want to be involved and help out with regional multimodal transportation. By multimodal, I mean cycle, pedestrian, vehicle, and those are the ones that we want to be involved in these stakeholder meetings, so that they identify what their needs are. The goal and objective is to get people from neighborhoods to destinations, and that may be a downtown commercial district, or a school in the morning, or recreational facilities. So that's the goal and objective. The term stakeholder is not intended to exclude any individuals or groups. It's to include representatives from groups.
Great. That's a really well described answer, because it is a big word. I see what you mean. And then under number 12, it says complete streets prioritization plan includes one meeting with town staff to review draft plan. So who's meeting with the town staff in that one? Is it referring to?
Oh, we've engaged an engineering consultant to help us, Woodland Curran. They helped us develop the policy that's before you tonight through the chair. That policy has been adopted by Mass DOT. It's a very similar policy. That policy has been adopted by Mass DOT for other communities. This isn't the first. And that consultant will work with us as staff to engage the stakeholders to develop the prioritization plan. And again, that includes master plan implementation, planning board, neighborhoods, schools, recreation, youth athletics, senior center, those groups, because they're the ones who are the users, and they're the ones who have identified through the master plan outreach that this is needed. The consultant will take those charrettes and all that information together and develop a draft prioritization plan that the staff can then get together and look at and realize what is a logical marrying of that prioritization plan to the sidewalk management plan and the pavement management plan, so that something can go to Mass DOT that is implementable, we'll say. And it includes a financial piece that will go backwards to the sidewalk management plan that says this is how we fund what the community wants.
Okay, great, thank you.
You're welcome.
Leslie.
Yeah, this is such an interesting thing, and again, I am in favor of it. But I look at it as if we're kind of like we're purchasing a product that maybe is a little bit more expensive than something else, but the state is making a good faith effort to provide funding that will partially offset the difference. Number one, but it also adds more structure and more formality around what we want to do in town and make sure that all the pieces are pulled together. So I think it sounds like a very, very good policy. It doesn't sound like there are any negatives to it, except for potentially the financial aspect of it. But I think if we make sure we explain it well enough to residents at town meeting when we're talking about the budget, and people understand that this particular policy really is a very comprehensive way of making sure that we accomplish what we want to accomplish and include everything that we need to include, and that all the parts are attached. So it just makes a lot of sense to me.
Thank you, Leslie. Scott, I had a question about going back to the green timeline here. February of 2022, just next month. There's a mention of additional points that can be secured if the municipality joins the community compact cabinet, or if they choose community streets as a best practice. What exactly does that entail? Joining the cabinet or declaring it to be a best practice? It sounds like kind of very accessible points.
I'll give you the engineer's perspective of it, and then John can touch base on the administrative side. I've worked with a lot of Complete Streets community as a consultant and as a municipal employee. I've reached out to many of my peers about it, and the vast majority of the Complete Streets communities that have been accepted through Mass DOT are not do not have community compacts with that give them the bonus points. So the community compact is an agreement between a community and the state, and it has to identify one of several, like many different bullet items. One of the bullet items is transportation. Other bullet items are, financial best practices, accessibility. There's a lot of different bullet items. The vast majority of communities have not adopted and engaged the state for the transportation piece of the compact, but they have had their policies adopted. I don't know, John, do you want to add in a little bit about the community compact?
Yeah, so the community compact program is a grant incentive program run by the current administration, which hopefully will continue after the administration ends, because both the lieutenant governor and the governor are not planning to run again, and this is one of their programs. So hopefully it will continue. We are currently working. We just awarded a contract to the consultant to do a community compact best practices MIS-IT strategic master plan. And so that is a project that we're working on at the moment. We really need to get through that program before we circle back and seek another community compact grant. But I'm not aware of this particular one for transportation, what's involved. But it's just a series of it's a series of best practices. If you remember when they first rolled the program out, one of the best practice areas where they offered grants for best practices in public budgeting. And actually Northborough was the presenter for that, to explain what best practices are. And the governor's office asked us to come out and make that presentation, which was great. But IT is where we identified as our primary need. Whether or not this transportation, we'll look at it, but we're not going to be able to, that's not something we're going to be able to do in February 2022. We've got to get through the grant, the community compact grant that we have been awarded already. We need to get finished through with this consultant for the master plan. And then again, if the program's there, we can circle back and look at it, but I don't see us being able to take advantage of that, at least not in this cycle anyway. And again, it doesn't seem to be, it's not necessary for us to move forward with everything we discussed here tonight. It's just a potential incentive, but like with it's just like the community, the Complete Streets, they're incentivizing you to do this program, but they're not paying for it. They're trying to take a little bit of the edge off of it for you. And so at this point, that step is not something I think we'll be seeing in February of 2022.
Okay, thank you very much. I'm curious because as we describe some of the initiatives we might pursue under Complete Streets, some of them are kind of, I don't know if you call them accessory development in conjunction with a primary development thing, such as completely redoing a roadway, that would be an opportunity to consider bike lanes or expanded sidewalks, things of that nature. I'm just curious, as part of the evaluation process, what would you do? Would you approach that as, here's the baseline project and the cost, and here is the full complete streets treatment and that cost as part of the evaluation process?
John, so the way I envision us going forward with the complete streets implementation is the grant money would go toward gap closure and connectivity, and for both pedestrians and or bicycles. The policy itself allows me as the director of the Public Works to implement complete streets on our roadway improvements. So we choose through our pavement management plan to implement improvements along roadway X, and roadway X has adequate roadway width, right-of-way width, and good condition sidewalks, but the wheelchair ramps are in bad shape. Well, now I have a policy to point to and say, I'm justifying spending 10% of the construction cost to rebuild this road toward doing cement concrete wheelchair ramps and warning tactile strips for compliant accessibility. I have a justification for doing that. On another roadway where there's adequate right-of-way and the sidewalks are in really bad shape, again, I can spend 25% more on that roadway project and point to this policy and say, this is going to allow a connectivity between X elementary school and this residential neighborhood, and it's a justifiable expense. And that's my goal, you know, all board, Mr. Chairman, that's what I want as a director, to have guidance from the community to say, this is where we want our resources directed. It's important for me.
And so, yeah, I just wanted to, I guess, kind of emphasize it's not just strictly project A cost versus project B cost, and trying to make a decision on a cost basis. It's more a policy-driven decision process. Certainly, there's some evaluation about what the incremental effort would be for a particular project, but generally speaking, the idea is that this is a priority for the community. And so for that reason, we're going to be looking proactively at those opportunities when they come up.
Yes, that's very well stated. We have a unwritten policy in Public Works in Northborough, as well as throughout my peers. You don't rebuild a road if the pipes underneath are broken. You fix the pipes and then you rebuild the road. That's just what you do, and that never occurs with sidewalks and wheelchair ramps. This, provides that policy and direction from the board to us to do that with sidewalks and accessibility improvements.
Yeah, I mean, really, what you have here is the direction from the board based on the master plan implementation and the master plan, the implementation committee. This is direction to the board, to Scott and myself, that this is where we want to go. And so this is where we want to go. Then we'll put together the plans and the financing, and then it'll be up to ultimately town meeting, what they are willing to finance. And if we do our jobs well and we space it out and we plan it well so that the costs are smoothed out over the years and they're consistent investments like we do with all of our capital. It's not just trying to do everything in one year or putting everything off to, whoever knows, to God knows when. It's, that it's that planning piece of it. At least then, because then when you go back to town meeting and you're asking for a particular amount of funding, you can point to, well, this is the plan based on this policy, based on the master plan implementations committee priority rating, based on the master plan process itself. And that's why we're coming to you with this. It's everything that we do. This is why I'm always like, we want to do things comprehensively, and you want the process to build upon itself so that when you get, because when you get to town meeting, that is not the time to be talking about the nitty gritty of this stuff and this sidewalk location versus that sidewalk location. That's not the forum for that. It's the rest of this process will build up to that. And just like we do with pavement management, we know we have $1.1 million every year. These are the roads that we're going to do this upcoming year. This is the condition of the roads. This is why they were chosen. And then next year, the following roads will be done. And I think the other piece of this that's important is that when it comes to capital planning, everybody wants services and they want the projects that impact them. And I think most people are willing to wait and be patient if they see that there's a process and there's a timeline where they're going to get what it is that they want, that there's an equity to the process and a fairness. It's not just whoever yells the loudest or shows up to meetings and yells the loudest, that there's a process here and there's a fairness to the whole thing. And it's justified. And that's what we want, because as staff, we want to be able to say, when I'm standing up at town meeting, making the presentation or the ask for the financing, well, this is why it's being asked. This is why it's a priority. And it's not just my opinion, but it goes through the board, the master plan, the community as a whole. So that's how we do that with all of our capital projects. That's why we have such a long running success rate with all of our capital improvements, is because it's done through that long-term 6-year plus planning process, and the commute time to communicate and to educate people. And you're not just kind of changing things or coming with town meeting with random requests, or worse than that, emergency requests. We have to do this because it's broken and it's a safety hazard. We always want to try to keep the policy boards and committees out of that type of a knee-jerk reaction, and that we're doing things long-term with a good plan. And ultimately, when it's all in place, you'll get to a point where we're fixing the things that need to be fixed and we're being proactive moving forward. But infrastructure in general is expensive, it's complicated, and it takes a lot of planning and coordination to get a good plan together. We've been able to do that with our roadways. It took several years to do it. We're in the process of completing the sidewalk master plan. This is just another prong to the approach of getting the ultimate goals that are laid out in the master plan.
Thank you, John. Julianne.
Yes, so I have a question for Scott. Back to that green sheet and the schedule. So for January, it says present draft policy meeting for public comment. So we're going to have public comment after this presentation. And then it says present final policy at follow-up Board of Selectmen meeting for acceptance. Does that mean we're voting on it January 24th?
No, the goal and objective is that tonight, pending public comment, the board can vote and accept it this evening. We put in a cushion in order to accommodate the schedule going forward. There's some milestones later on in that green sheet schedule that need to be met for grant applications. And the goal and objective is to get acceptance tonight. In the event there was public comment or board inquiry that required amending the policy, we will amend the policy and come back before the board at their next meeting. If there is not comment and inquiry that requires amending beyond adoption of amended, then we can accept it tonight.
Okay, 2 more quick questions. So what's the turnaround from when we accept to when you submit the application and then hopefully hear back? Like,
if the policy, through the chair, if the policy is adopted this evening, January 10th, my expectation is that we'll be submitting that adopted policy within a week after the town clerk certifies the vote. And after that, it's on Mass DOT's desk. So that could probably, I don't know. Are they working remotely? Are they quarantine? I would hope it would be within another week, but I've seen things sit for a long time, and I've seen things come back in 2 days. So it depends on where their priorities lie.
Okay, and one more question. I'm sorry, on page 2 of the policy, where it says exceptions, Roman numeral 4 says the activities are ordinary and or preventative maintenance designed to keep assets in serviceable condition. Like, what does activities are ordinary mean?
So let's say there's a gutter line that has been failing because of poor drainage, and we go out there and we mill out that gutter line. By gutter line, I mean the where the curb is and the roadway meet, and I need to mill that out and fix it. I don't necessarily need to apply the policy to correct 80 feet of sidewalk where that gutter line is failing. I'm just going to maintain that. Or another example is I have 3 miles of road that I'm going to crack seal. That's preventative. I'm going to crack seal that. I have a hot wagon with a crew that's filling cracks. There's no reason to be rebuilding the sidewalk adjacent to that crack sealing. Those are the 2 exceptions that are included in that bullet item.
Okay. All right. Thank you, Scott. I think this is a terrific project. And I think the policy reads very well. Thank you so much.
Thank you. You're welcome.
Thank you, Julianne. Leslie.
Yeah, Scott, who put together this particular policy for the town of Northborough?
I did with Woodard and Curran, and we based it on 2 other communities. I took 2 other communities' policies. I looked at, I don't know, maybe less than a dozen, more than a half a dozen, and pulled 2 or 3 out of them that I liked. And of those 2 or 3, we blended them together and came up with this policy. It allows enough accommodations for bicycle, wheelchair, sidewalk connectivity. And the key, I think, in our community is connectivity. Other communities have other issues. Our community, I believe, is primarily connectivity, getting from residential areas to schools, and from schools to recreation, and residential to schools. So I focus primarily on connectivity and marrying that with our roadway program.
Okay, it's interesting because it's kind of a variation on a theme, and it sounds like a complete streets policy in general has to include, A through Z for the most part, with some minor variations depending on what our community needs are perceived to be.
That is absolutely correct. The Mass DOT's goal is not to say, here is your template, put town of Northborough where it applies and adopt it. The goal and objective of Mass DOT is to allow communities to adopt what's appropriate for them.
Okay.
And I believe what we've presented before the board this evening is appropriate for the community's needs.
All right. Very nicely done, Scott. Thank you.
Thank you.
Julianne?
Oh, I have one more question. So in 2 years, if we realize that we have to amend or add to this, what's the is this set in stone, or can it be added to if we need to?
This could be through the chair. This could be revisited. It's a living document.
Okay.
This could be revisited as we move forward. My hope and goal is, 5 or 6 years from now, we're sitting here and our gaps are connected, and we identify more needs that don't include, connectivity gaps, and we can amend the policy. That's just where I want to be, but it can be amended. It can be amended.
Like that goal. Thank you.
You're welcome.
Very good. Any other questions or comments by members of the board? Seeing none, we'll now open for public comment, and I'll just quickly go over the procedure here. Everyone I see is connected to the Zoom webinar. So if you wish to speak during public comment, you can use the Zoom mechanism to raise your hand. For each person, we'll bring them into the meeting to speak. You'll first please identify yourself by name and address, and then you'll have 3 minutes to offer your comments. We, as a general policy, we ask that you conduct yourself in a professional and respectful and constructive manner in presenting your comments. With that, I will first bring in Michael Hirsch.
Hello, thank you, Mr. Perot. My name is Michael Hirsch. I live at 19 Smith Road in Northborough.
Very good. Please proceed.
I happen to be married to one of the selectmen on the board, but this has nothing to do with that 42-year-old arrangement. I'm calling because I wanted to give thanks to Chief Liver of the Northborough Police Department for his participation in our 20th annual gun buyback program called Goods for Guns, which occurred on December 12th, the approximate 8th anniversary of the Sandy Hook massacre. We were able to get 9 communities to participate along with Worcester.
Sorry,
and
I'm sorry, Mr. Hirsch, if I could interrupt for a moment.
Yes.
This segment of our agenda concerns this presented policy for complete streets. And the comments we're taking at this time are specific to that agenda topic.
Okay.
We can certainly bring you back in. We'll have a general public comment later on the agenda here.
Okay, thank you. Sorry if I interrupted.
Sorry for the confusion. Yeah. Members of the public, if your hand is raised, I'm bringing you in, and this is for the topic of the complete streets policy that's being considered by the board. Next up, we have Mitch Cohen.
Hi, everyone. Jason, thanks for bringing me in. This is Mitch Cohen, 12 Whitney Street. I think this is a fantastic plan. I'm very excited to see this happen. As I've mentioned before, the sidewalks in front of my house are fantastic, and I look forward to more of those great sidewalks elsewhere in towns. Particularly the idea of connecting some of the disconnected areas makes a lot of sense. A comment or really a question about the public participation a little bit later in the process. That I see that there's obviously the opportunity for the sidewalk and an online survey, which is great. In August, it looks like there's a meeting with town staff to review the draft plan, and then it needs to be submitted by September 1st. What I'm not sure about is what is the level of public participation or board participation, really with public participation on top of that, around that time frame, so that everyone can be aware of what's in that draft plan before it goes in. And secondarily, I'm curious whether that the plan that is submitted is reviewed by the Board of Selectmen before submission, or if that's a staff level decision. Thank you.
Yeah. Scott or John, would you care to field that?
I'd be happy to, Mr. Chairman. So the goal and objective of the public involvement is to engage a variety of boards and residents. So my expectation is that we'll be before the Master Plan Implementation Committee to talk about the prioritization plan. The planning board will likely be one of them. There may be some, as Mr. Cohen indicated, there'll be a public survey, and when all the information is brought together, the prioritization plan will be reviewed by staff. My expectation is not that the prioritization plan will go before this Board of Selectmen for acceptance before it goes to the Mass DOT.
Yeah, through the chair, if I may also, the Financial Planning Committee does our 6-year capital improvement plan. They would be heavily involved in that as well. They're the committee that lays out and approves or recommends the financing structure for all of our significant capital improvements that go to town meeting. So the appropriations would have a role in that as well. Ultimately, as the segments are brought forward, the town meeting will be approving these funding plans as well.
Thank you.
Thank you, Mitch. Next up, I have Bill Pierce.
Thank you, Mr. Chair. Can you hear me?
Yes, we can.
Okay. My name is William Pierce. I reside at 367 Whitney Street. I'm speaking tonight as a resident of Northborough. I have two statements and two questions. First, I would like to thank Mr. Charpentier and his team for starting this process. Working for a state authority myself, I understand that it takes a lot of time and work to apply for these programs. So thank you to you and your team for getting this started. As much of the work of this is part of the master plan, it's already been identified that the residents want to walk around downtown and throughout the community, and that it's important. I've always been taught that if you're going to do something, you do it correctly the first time. If we use this program to recover some money for our roadway projects and do it the right way, it sounds like our roadways and sidewalks will last longer and be better for the community. It'll keep us out of court for ADA compliance issues like poor wheelchair ramps, and may even reduce the long-term costs because the projects will be done right the first time. That's my statements. My first question, I understand that the Complete Streets program is more than just sidewalks. It's about all modes of travel throughout the community. I also understand that you'll be going through an outside source for the prioritization plan, or at least part of that. With some of the items that have been discussed in past meetings, specifically the fact that the DPW is constantly monitoring the condition of sidewalks and roadways, what are the projects that Mr. Charpentier in his expertise would prioritize for the community? And then my second question is about time frame. Both Mr. Charpentier and Mr. Coder mentioned a sidewalk maintenance plan. What's the time frame of the current sidewalk maintenance plan? And by utilizing this program, are you able to speed up that plan? Thank you.
Thank you, through the chair, Mr. Pierce. The time frame, I'll answer your second question first. The time frame for the sidewalk management plan, we've engaged our consultant. So we do a pavement management plan. We've been doing that for a number of years. And every other year, our consultant goes out and travels every single lane mile, roadway mile in the community. Every other year when they do that, they gather more information about different pieces of infrastructure. They've gathered our curb conditions and materials. They've gathered our sidewalk conditions and materials, our guardrail conditions and materials. We've compiled all that information. We're in the process now of developing a sidewalk management plan, which is very similar to a pavement management plan with that data. The sidewalk management plan identifies what we have for sidewalks currently, the wheelchair ramps, the widths and the conditions and the materials. As part of that plan, there'll be a capital piece of it at the tail end, like it is in our pavement management plan, that identifies what the condition is, what a recommended approach is to remediation and repair of these sidewalks going forward. So the sidewalk management plan is scheduled to be completed in draft form and before me by the end of the month, January. The expectation is that I get comments back to my consultant. I get something back from them in February, and the Complete Streets policy is then before the Mass DOT for acceptance. So come next construction season, the sidewalk management plan and the Complete Streets prioritization plan are coming together for funding for next construction season. That's the schedule going forward. The former question regarding the intermodal connectivity, our goal and objective is not simply improving wheelchair ramps and sidewalks in the community. You know, there's a piece of bikeability that has been expressed to me and it's been louder and louder over the past few years. So there's a component of bikeability that's part of our complete streets policy that'll be implemented with our pavement management and our roadway improvement plan. The third part of the complete streets policy, other the complete streets program in Mass DOT, is public transportation, which in Northborough, outside of the senior center with WRTA, is not a really applicable piece. So that I don't see bearing any fruit in the community.
That answer your questions, Mr. Pierce?
Yeah, I think I was, I agree that, there are a lot of sidewalk and bike opportunities in the community, and that it's been, asked for many times over the years. So again, I appreciate all the work you've done on this. I just wish, there was a little bit more detail as to, what some of the projects are that are going to be done in the next, say, 3, 5, 10 years.
That's the point of the process, to identify those. That's the point of the process. So we'll get there.
Thank you, Mr. Pierce. Rick Leaf, next up.
Thank you, Mr. Chair. Can you guys hear me okay?
Yes, we can.
Okay. My name is Rick Leaf. I reside at 30 Wiles Farm Road in town. I'm a member and the vice chair of the Master Plan Implementation Committee. And I just want to confirm a lot of what Scott has said tonight about the working relationship that's developing between the committee and the DPW and the town administrator's office. At our December meeting, the entire focus of the meeting was to talk about the transportation section of the master plan. And within that, there are a number of goals related to pedestrian safety, walkability, and bikeability, and some actionable recommendations as to what town residents wanted to see. And the big point of discussion was, how do we take the items that are in the plan and make them a reality over time in town? And certainly what Scott has proposed tonight with the complete streets program, first the policy, and then the actual pulling together of a lot of different constituents in town to put together a plan for approval and then funding, is the way to take the items that are in the master plan and coordinate them with all of the other transportation things that the DPW is working on, and have a coherent plan we can work on over the next few years to make things a reality. So I'm speaking now just as my personal self, but I think also reflecting the opinion of the Master Plan Implementation Committee that this process we're talking about tonight and the development of this priority plan that would follow the adoption of the process is the way to go. And it gives the committee something concrete to work on with the town to make sure that what's in the master plan eventually gets implemented. So I congratulate you, Scott, on getting this far, and hopefully we'll keep going forward. Thank you.
Thank you, Rick. Any other members of the public who wish to speak? Lisa Maselli.
Hi, good evening, Chairman. Thank you. This is Lisa Maselli at 13 Maple Street, also on the Design Review Committee. I have a couple of questions. First off, how will this affect the commercial buildings that come before us that are supposed to put connective sidewalks in the areas of the Main Street, West Main Street, East Main Street sections? I would assume it doesn't. I would assume that they'll still be part of having to put those in as is the bylaw. The second is that I'm a little concerned on timeline because I hear numbers like 5 and 6 years, and that's how we do the capital improvements program. And we're not looking to put any new sidewalks in before 2023, if that's what the chart says. Is that correct? And the third question I would have is, although we have a capital improvements plan, that's usually a 6-year plan, sometimes it does change. The Peasley School was up for renovation, and it was set aside for the fire station, and that's kind of languishing now. So I'm just concerned that as we put the whole policy together, and it's very nice, and it's hopefully going to be very concise, that the timeline on it is 5 to 6 years out. And I don't know that people are really that willing to wait that long. Thank you very much.
Thank you, Lisa. Scott, yes, would you care to?
Yeah, through the chair. So
Sure.
The effect on commercial construction, or all, construction that goes before the planning board, design review committee, zoning board of appeals, has to comply with complete streets policy. The policy is not just applicable to DPW. It's applicable to development and redevelopment. If a developer comes in and wants to redevelop a street, a property on Main Street, he needs to comply with the local policy. That's it. Same thing with the subdivision. Not that we have a lot of those, but they still come up, and a subdivision needs to comply with the complete streets policy. That is part of implementing this over a very long-term horizon. That eventually, as properties get redeveloped, they're all complying with the same policy, and there's some continuity with the development. The second question that Ms. Baselli had was related to the timeline for new sidewalks specifically. New sidewalks are not easy. I've spoken before this board and other boards and committees before how challenging a new sidewalk is. New sidewalks, as soon as you put a sidewalk in, you put a curb in. When you put a curb in, you put closed drainage in, catch basins and pipes. When you put pipes in, they need to go somewhere. When they go somewhere, they need to discharge. And that discharge is generally a drainage easement. And often when you put a sidewalk in someone's front lawn, it either changes the topography relevant to their front lawn draining into the road or in the opposite direction. So there's a lot of challenges associated with new sidewalk construction. So while, saying 2005 is a long time to talk about a new sidewalk, well, we're currently discussing FY23. And FY23 could accommodate funding for design and easements for a new sidewalk. And then FY24 could accommodate funding for a final design and grant submission or funding submission for new sidewalk construction. And FY25 could be actual construction. So while FY25 sounds like a long time away, when it comes to public construction, Mr. Chairman, it's actually not when you're talking about easements and property acquisition and the like. So that's kind of the long-term response. The short term for complete streets is that as we implement our pavement management program and our sidewalk management program, we have a policy to point to that says we are rebuilding X roadway. And as part of that, the community has decided that it is a viable expenditure to rebuild the sidewalk adjacent to it because it's important, because it connects Peasley School to something, or Proctor School to something, or Memorial Field to somewhere. That's what I need from the community to say this is a priority for us. The last comment or question that Ms. Maselli had was related to the capital improvement plan that changes dynamically, and it changes dynamically based on needs. So if I was to get funding at FY23 town meeting to secure easements for a sidewalk extension along Maple Street from Ridge to Bartlett, and every resident there said yes, and applauded us, I would love to have the capital improvement plan change and allow us to fund that the next year and push it up a few years, or push it back a few years if there's drainage issues and easement issues. So the capital improvement plan is a living document, just like the prioritization plan that I talked about earlier.
Thank you, Scott.
You're welcome.
Do you have a follow-up question, Lisa?
I do. Under the first discussion on policy for commercial development, I'm confused. If you could just explain what you mean by that. Is it policy over bylaw? What does the policy actually do to direct the developer and us on the design review board? How could you explain what you mean by that?
Yes, through the chair, policy, and John, correct me if I'm wrong, please. Policy does not overrule bylaw in any instance. Policy is a guidance document that indicates this is what the goals and objectives of the community are. And I would hope that the boards and committees and commissions in Northborough abide by the policy, but it's not a bylaw. It's a policy, so it's more of a guidance document.
But I'm asking what you mean by that as a policy document, just for guidance. I'm a little confused by what it is. Is it supposed to, does the policy say the height, the curbing, the whether it's made out of concrete or hot top? Or that's what I'm looking for. What does the policy, how do we implement the policy in carrying out the direction for construction?
So the policy is not a bylaw. It does not identify, it does not define construction means and methods.
Okay.
It identifies accommodations. So when a commercial, any development comes before a board or commission or committee in Northborough, the policy says provide accommodations for multimodal transportation, bicycles, pedestrians, ADA accessibility. In some instances, public transportation, but likely not here. That's the goal and objective. The policy does not identify sidewalk construction, depth of gravel, surface material. It identifies compliance. Mr. Chairman.
Thank you very much, Scott. Thank you, Lisa.
Thank you.
Any other members of the public who wish to speak? Seeing none, thank you very much. Members of the board, I think we're kind of at the point here. Does everyone feel comfortable enough with the policy as presented, that it's sufficiently comprehensive, that it is reflective of policies that DOT has previously accepted, and that it's in the best interest of the board to consider an approval this evening in order to expedite the timeline to have the policy processed by DOT and put us on a path toward further progress? Comments? Julianne?
Yeah, so based on the last question, I guess I'm confused again. So if, let's just say there were concrete sidewalks along Main Street and a developer comes in and the guidelines say that the developer has to put in a sidewalk. Scott, are you saying that developer can put in asphalt even though the rest of the sidewalk is all concrete? It's up to the developer to decide on the product?
Through the chair, I'm sorry. So Main Street's a different situation because that's Mass DOT. So we'll say South Street, for example, and the developer will have to replace, if the board or commission who's reviewing the submission requires it, replace the sidewalk with a compliant sidewalk. If it's cement concrete, my expectation is that, the board or commission reviewing that plan would not allow them to replace it with asphalt. The policy says if the sidewalk in front, let's say it's a perfectly good cement concrete sidewalk that's 4 feet wide, the policy says the developer needs to replace it with a 5-foot wide sidewalk from back of curb, because that is a compliant sidewalk where 2 baby strollers or a baby stroller and a wheelchair can pass each other. That's what the policy says. It's up to the board or commission reviewing that to say it was concrete before, it needs to be concrete now.
Okay.
But the policy says it needs to comply with the complete streets, accessibility and or wheelchair and bicycle accommodations, which is a 5-foot wide sidewalk behind curb.
Okay, thank you.
You're welcome.
Thank you, Julianne. Board members, any other questions, comments? Seeing none, do I have a motion?
Yes, Mr. Chair, I move the board vote to adopt the complete streets policy as presented by DPW Director Scott Charpentier.
Second.
Moved by Scott Rogers, seconded by Leslie Rattan. Any further discussion? Seeing none, this is a roll call vote. Kristen Wickstead.
Aye.
Julianne Hirsch.
Aye.
Scott Rogers.
Aye.
Leslie Rattan.
Aye.
And I, Jason Perot, vote aye. Carries unanimously. Scott, we cannot thank you enough for all the work and detail that goes into this. And as you mentioned, you do have some past experience and qualifications with regard to complete streets. Certainly a very valuable resource for this community to have you pursuing this. So appreciate all of the hard work, and thank you very much for your very comprehensive answers to these questions that we've had tonight.
You're welcome, Mr. Chairman. I appreciate the board entertaining me this evening, and I look forward to implementing it. Thank you.
Great. Very good. Thank you, board members. Appreciate the consideration tonight and moving forward to adopt the policy. Next up is reports. We'll begin with Kristen Wickstead.
Hello, everyone. Haven't done a report in a while. We did get an email about the pickleball courts, and I just wanted to say Scott was super helpful explaining what's going on with the pickleball courts to the extent that, well, no, I didn't mean to the extent that. I just wanted to say his email about that to everyone was super helpful and very detailed in the typical DPW Scott way, because there's 2 Scotts, so we call you DPW Scott and I guess Board of Selectmen Scott. I don't know. Scott Rogers doesn't have a nickname. Anyway, sorry, I'm rambling. We did get a reply to that email from Jason with a smiley face, and I have to say that was the first time I've ever seen Jason put a smiley face in an email, so I thought that was pretty special. I think Jason likes pickleball.
He said, no, nobody wants those pickleball courts more than I do, believe me.
Yeah, I thought that was great. So, yes, but it was well explained. Troop 101 picked up 450 Christmas trees. Thanks to everyone who participated. And a thanks again to DPW for working with the troop to dispose of all the trees. That was a big deal. And then I just have a quick poem for you. It's by Robert Frost. The rain to the wind said, "You push and I'll pelt." They so smote the garden bed that the flowers actually knelt and lay lodged, though not dead. I know how the flowers felt. I think we all know how the flowers felt right now with the surge of Omicron, just when we were all getting really done with COVID and with lots of freezing weather coming. I really wish everyone well, and remember, we're all in it together. And somebody's dog obviously agrees with me about that poem. Somebody's dog likes poetry. Okay.
Very sorry. That was my dog. Usually he likes to just sit in the office here quietly.
You never know. Robert Frost fan, huh?
I guess so.
Yeah. All right. Thank you.
Thank you, Kristen. Next up, Julianne Hirsch.
Thank you, Mr. Chairman. The first thing I'd like to say is I think tonight's presentation by Mr. Scott Charpentier was indicative of how helpful it is that our packet information is online now before the meeting. I think obviously some residents had a chance to read through it, and it seems to be working. So thank you for that. And my first report is about MPIC, Master Plan Implementation Committee, which is meeting monthly now on a regular basis. At our last meeting, we had a presentation by Cultural Council where Suzanne Cox told us about a temporary public art project that the committee is planning. It's the project you've heard a lot about with the painted doors that will be placed around town in early spring. But the presentation was geared towards some of the goals of the master plan, particularly land use and economic development, and how this project will support those goals. At that same meeting, we had another interesting presentation by Dario Damare, who did a beautiful slide presentation on characteristics of downtowns that make a downtown more inviting to foot traffic. He talked about bump outs and parking, lighting, and other enhancements to the landscape that a person wouldn't necessarily consciously notice, but things that make a downtown more inviting. So in the context of our Complete Streets program, now this is coming at a very opportune time as MPIC identifies projects that will probably align very nicely with the Complete Streets program. Next, CPC met on January 6th, and all projects were presented, and the committee had a chance to ask questions and start their consideration. And they will be meeting again in a few weeks. And I would like to thank Community Affairs for another successful tree lighting. It's a lot of work, but it's so wonderful to see people gather together to start the holiday season. And my last item is about ARPA funds. And I know I brought this up a few times, and I want to be mindful tonight about how our staff is burdened with absences and people, work staff being curtailed by COVID. But I do think that it is important that we start to discuss the ARPA fund program as soon as possible. We are eligible for $4.5 million. And as yet, we haven't really had a discussion about how to make decisions to use those funds. I'm not sure if any of you had a chance to read the final rule sent out by DLS, but there's a good summary of the guidelines. What I'm hearing in committee meetings are questions already about the use of the money for certain projects. And so I think we have to make some decisions about how we can get all of the possible projects for our town in some sort of list and start to prioritize. So here are some questions that I would like to see addressed. When are we going to start hearing from the public about what projects or services are needed in town that would benefit from this money? What is the process? Will we send out a survey, have a listening session? Who decides? We'll probably come up with a list that exceeds $4.5 million. And at that point, some committee, board, or town meeting will have to decide what our priorities are. I've read that towns near us are forming committees, special committees to do just this work. Some towns are having public input opportunities. Some towns are hiring a consultant. Some have already made decisions about how they're going to use the money. I recognize that we have a very efficient budget process, but this money, I feel, has to be discussed separately. It's really not even once in a lifetime. It's once in a century that towns and cities get this kind of money handed to them with such a wide scope of possibilities. So I'd like to get my fellow board members' feedback on if you would like to include this on as an agenda item in a meeting coming up soon. I had hoped that maybe we could get it on the January 24th meeting, but I think that would also have to depend on how COVID is hopefully waning. But I don't think it has to be, you know, a crash course in ARPA, COVID related funds. It can just start to be a discussion on how we're going to make this list of projects. Do we want to talk about hiring a consultant? Do we want to talk about having a committee? So I think for me to get feedback from my board members, I would like right now to make a motion. I move that ARPA funds and any other COVID relief money available for Northborough be included in an agenda as soon as possible. This will include topics such as amounts available, amounts used, revenue shortfall, public input, forming a committee to prioritize funds, hiring a consultant, and any other topic pertinent to using these funds. So that's my motion.
Okay, I don't know that during reports is an appropriate time to present a motion for action by the board that wasn't previously communicated to the board to be
Well, I
treated
have
as business.
communicated this previously a few times,
Yes.
asking for it to be on the
So
agenda.
to answer your questions a couple of times here. Number one, as you just stated yourself, we've only just received the final policy or rules or regulations regarding the ARPA funding. And one of the items you left out in your list of actions being taken was the fact that at least one community has been told to return money that they've spent because they spent it on ineligible expenses. So what I would like to do is go with the guidance of our town staff who have been working through this and are going to be prepared to provide some guidance on ARPA in the near future. But I don't yet see exactly what we're going to do in terms of details about project lists and public input for that until we fully understand the ARPA program and the eligibility and what items can be undertaken, what items cannot be undertaken. That's my stance on this. John, yes.
If I may, look, I'm happy at an upcoming meeting within the next 2 meetings to provide an update to the board. But as far as the funding, it's important to note that the final rules were just completed Thursday. So in fact, one of the, and we have been having discussions with various boards and committees, with departments, with community groups. And one, you mentioned the community preservation. I've had discussions about affordable housing. But one of the rules that they just changed was opening things up for affordable housing. It wasn't an allowed use or wasn't an allowed expenditure explicitly before they changed or finalized rules on the 6th. So it's important to know what we're doing. But beyond that, it's not as though we're going to start from scratch. As I said, we have a 6-year capital improvement plan, and we have a master plan implementation committee. Those plans, those long-range financial plans are what will drive most of, in my opinion, how that money should be spent. We talked about it a little bit at the financial trend monitoring as well, in that these are one-time funds. Sounds like a lot of money, but it's not a lot of money in the grand scheme of things. And if you're looking to do things like the master plan, we have a placeholder in the capital improvement plan that was put in there explicitly for master plan implementation committee priorities. And they've already identified the 2 top priorities as being a downtown master plan and and sidewalk master plan, walkability, the things we talked about this evening. Those two things, the existing plan for capital improvements, we talked a lot at your last meeting about how we got through this pandemic was postponing a lot of our capital projects. So those things, as I said at your last meeting, those things should be the priority. There will be capacity in there to do other things. A big thing right now that I'm concerned with is also just making sure that we have capacity to deal with whatever's happening with this pandemic that doesn't seem to go away and keeps coming back. But I'm happy to, at an upcoming meeting, to give some information about where we are with this. Keep in mind too, our free cash certification just happened last week as well. So the Financial Planning Committee is the committee that puts together the capital improvement plan and is going to work with the Master Plan Implementation Committee about their priorities. They are just beginning their work. And ultimately, as with any process that we have, particularly a financial process, the Board of Selectmen relies on the Financial Planning Committee, the staff, and the Appropriations Committee to provide recommendations and to provide a framework and context for what's recommended. And so that's the process that's taking place right now. But I'm happy to provide an update on where things stand at an upcoming meeting. That makes perfect sense. Doesn't need to be a formal board vote. We are, as I said, at our financial trend monitoring last week, for a variety of reasons, we're behind in our normal process by about a month or a month and a half, based on the issue with the order, closing out all the grant administration, dealing with COVID. Things are behind. That's just where we are at the moment. And so I've asked for your patience, and I appreciate it. But the boards and committees that need to inform, the Board of Selectmen and ultimately town meeting need a chance to review the basic information as well and start to do it in the context of the existing plans. And that, I think, is the framework that needs to take place first. But I'm happy to provide an update on where things are at your upcoming meeting.
Julianne?
Well, thank you, John, for that offer. And I hope it is soon, because there are short deadlines to how some of this money has to be appropriated and then used. And I believe it's less than 6 years. So I thank you for that offer. I look
2 years.
forward to that. Sorry?
I'm sorry, I didn't mean to interrupt. I was just saying the funding comes in 23 and 24. It has to be expended within a certain time period. So
I think that's 26, right?
So there isn't, again, there's time. I think the most, I would, I expressed this at the financial trend monitoring meeting, the priority needs to be, in my opinion, the things that were cut to get us through the pandemic. But there will be ample time for us to, again, in the context of the Master Plan Implementation Committee, in the context of the capital planning, to talk about all of these needs moving forward. That's the committee's roles. And that ultimately this funding source will be taken into consideration as part of that.
Okay, so this is exactly why my motion stated that I would prefer to have this on an agenda so that we can spend time discussing it. But as long as John is willing to, open this up for information and discussion at an upcoming meeting, I'll retract my motion and hope that we can have a good, healthy discussion about it at that time. So that ends my report. Thank you.
I understand there's a lot of questions and there's a considerable amount of money. In part, in order to frame this, Julianne, I'm waiting, and we were waiting and working with the Master Plan Implementation Committee, which you're a part of, to see what projects are coming out of there, to start seeing how all these things fit together. So our job as staff is to frame these things up so we can have an informed discussion about that. And like I said, that we just got the final rules for things like the request of, potentially affordable housing. The final rules just got approved on Thursday. We do have a sense of where we're going, and there'll be appropriate time to discuss this stuff. So, but I appreciate the comment.
Thank you.
Scott Rogers.
Thank you, Mr. Chair. Yeah, I think just the time period that we're in, we're seeing the culmination coming from a lot of the boards and committees and commissions that we're part of that finish up the budgeting cycle. So as John mentioned, free cash just got certified. Some of the other things that allow us to clear out. So now we're seeing from the school committees, budgets, operational budgets, capital planning budgets. We'll see the work begin on capital planning. So getting ready for the budget process and town meeting coming up. So as I've watched all the events, meetings that have occurred since our last meeting, whether that be planning board and some bylaw changes, or the school and their budgets, you see everybody coming together and getting ready for this next cycle and what ultimately becomes warrant articles for town meeting. So that's a general statement on just keeping a watch across all those different boards, committees, and commissions. Of particular note, I think we're probably planning, Becca, on our next meeting, the 24th, to hear from diversity and inclusion. Am I tracking that correctly on their recommendations?
That's correct.
Great, looking forward to that and the final report and the recommendations to us next. And then just finally, or not finally, would want to thank Chief Parenti for his report. As always, appreciate the extra comments to just give the feeling, the perspective of what's happening within the fire department. And then finally, just want to recognize maybe a couple staff members and maybe tee something up for you, John. Just want to congratulate Kathy Tubert on her retirement, long-standing service to the town. And then an upcoming congratulations to Mia McDonald as she steps forward in her career and starts some work with the Department of Environmental Protection at the state level. So just want to thank both those ladies for the service to town, and it's been wonderful to work with them. In the case that I've been involved with the boards and committees, a relatively short time against Kathy's long-term service, but in both cases, they are wonderful people, and they will be sorely missed. That ends my report.
Thank you, Scott. Leslie.
Okay, I would like to thank the police and fire chiefs for their monthly reports. I think it's those two departments do so many things behind the scenes, and I think it's hard to appreciate all the work that they do to keep our community safe. It's just very interesting to read the activities, the numbers, the data that they provide, and it's really fascinating to really sit down and look at that, because it's not something you think about on a daily basis. So I want to thank both the police and fire. Also, thanks to the DPW for all their snow plowing and also sidewalk clearing. The sidewalk machine is pretty nifty, moves pretty quickly. Does a very effective job, it seems. So those are great machines. I just want to thank you for all that, because the DPW works very quickly to get the town cleared very nicely, does a great job. But I did want to ask you, Scott, are there any obstacles that you are finding in general over the last couple of years as far as being able to do your job properly on the roads or sidewalks? Are people pretty good about where they're parking their cars and things like that?
Yeah, through the chair, the community is fantastic. Obeying the no parking when it's snowing out. The biggest challenges are the first snowstorm. You're on a sidewalk machine and you're trying to find the sidewalk in a blanket of snow at night. And it can be a challenge. It needs to be understood that, we go out, we salt as soon as the first flake falls, and that takes a good 2 or 3 hours. And then they all get in their plow trucks and do what they have to do in the snow, clearing the roads. And then when that's done, two unfortunate or fortunate DPW employees get in the sidewalk machines, and then they go around town. So, these are our fathers and sons and brothers that they're 14 hours in and they're working on the sidewalks. And it takes a good 7 to 10 hours to do them with a V plow. And if you get 10 inches of snow, they're in the snow blower, which is a 20-hour day. So it's a lot of work, and when they're out there and there's the first blanket of snow, it's a hard time to find where the sidewalk is. So anybody who suffers any, lawn damage, they reach out to us, we put it on our list, and we come back out in the spring and we address their needs. So, I appreciate acknowledgement, Leslie. I appreciate that very much.
You are welcome. And I only have one other question for you, Scott. Are those trucks and plows heated?
They have heat.
Okay.
They have fans, because when you sit in there after plowing all day and your jacket is covered in snow, and then you get into this small glass box and have to ramble down the sidewalks, it is the steamiest, most difficult thing to live in. So there's like 4 fans blowing on all the windows, trying to clear the windows.
Wow.
They are heated, but they're humid.
Okay. Well, it's a little bit better then. Okay. Thank you very much. Please thank your department for us.
I will. Thank you.
Also, I would like to ask residents to please consider donating not only to the Northborough Food Pantry, but to the American Legion Veterans Food Pantry. And for information, you can go to bc4t.org to find out the items that are needed, what the hours are as far as the pantry in terms of drop off, and who is eligible to use that pantry. But it's a very, very nice food pantry. It looks fantastic. BC4T, BCAP, Burroughs Cares for Troops does a wonderful job maintaining that, and I want to thank them for all their work. I attended the Northborough School Committee meeting on January 5th, and there was a principal's report and some PTO updates. But what was the most interesting thing is that their largest capital item, which is replacing the Proctor roof, is being deferred until fiscal year 24, so that we can receive we can go after some MSBA funding, which is critical. So I know that's a big deal, but apparently that was going to be, I know John knows probably more about this than I do right now, but that was one of the biggest things that Greg Martin, the superintendent, discussed at that meeting. So hopefully, I guess there'll be some intermediate mitigation going on so that they can live with the issues that roof is going through right now, and then just put that in the FY24 capital budget. So, yes. And also my last note is to thank Republic for, from what I understand, they were able to get around today and pick up all the trash remnants from last week and the delay and so forth. They worked very hard. I know there have been some issues with COVID and staffing and so forth, and I know it's a lot of work on their part with that in mind, but they're a very conscientious company. Whenever I am at home and I see them pick up trash, they're the kind of people that some trash will blow underneath the truck, and they actually get in the truck, move the truck, get out, put the trash in the truck, and then drive off. They're not just trying to get out quick and do their job and take off. So I just want to thank them for their job. And John, if you wouldn't mind passing along our appreciation to them for that.
Sure, I'd happy to do that. I was going to mention, if I may, through the chair, there was some issues in this past week. We received a very professional letter from them. Essentially, they had 5 drivers out with COVID, and it's the same drivers that drive our town and drive the same routes every day. If you ever had kids, when you ever have children, if anybody who's ever had children who took the bus and the bus driver was out, and you stand out on the side of the road waiting for the bus driver, and they never show up, or they take the wrong turn because they don't know the route. They were dealing with a lot of that. And so they had difficulties. They had replacement drivers, but they didn't know the routes that well. And I think the thing that to your point, Leslie, is they made a commitment to come back and pick up whatever was missed. So if anything was missed, if you let us know, if you let the town clerk's office know, they committed to getting back out there and picking that up. We did on Sunday, working with Andy Dowd, Leslie and I probably spent about 2 hours going around on social media and getting things up on the website to make sure that everybody understood what was happening and why. Because in 25 years, I've learned people may not understand a $75 million budget, but they know when their trash doesn't get picked up, and everybody's got a strong opinion about that. But I think once people understood the reason behind it, that it wasn't poor service. We've had this company for 8 or 9 years. Honestly, I've worked with every major hauler, and they've just been consistently excellent service and very conscientious. And but COVID was the root of the problem, and they've tried to make amends for what transpired. But it's important that people understand it's not just poor customer service. We're all sort of dealing with the staffing shortages and the workarounds due to COVID. But I appreciate that. I will pass it along. And I did send their letter to you folks, to the board, just so you understood what was going on in case you received questions. It's just, again, things happen. It's about good communication, making sure that people understand why. And it's not just poor service. There's some extenuating circumstances. As always, you get COVID plus a storm plus Christmas. Gives you some difficult things. So things tend to stack up like that.
Exactly. All right. Thank you. That is my report.
Thank you, Leslie. For my report this evening, first, for the financial trend monitoring system meeting we had with the joint meeting of the boards back in December, I just want to thank John, Superintendent Martineau, and perhaps the MVP, Jason Little, our finance director, who has been just absolutely underwater trying to keep up with all of the documentation requirements for all of the federal and state assistance for COVID issues, for trying to get our FY23 budget organized, and then pulling all this information together for financial trend monitoring for us to be able to.
Don't forget the new audit. Don't forget the new audit
and the new
started.
yes,
So he's entertaining them, trying to orientate them
yes.
around the town. So it's been busy.
Right. So he's basically been doing the equivalent of 3 or 4 jobs as John typically does also, and as Scott typically does also. The effort involved in the professionalism just to follow through on all that to try to keep us on track for a December meeting. As John mentioned earlier, we're a little bit behind in our budget process, but there are plenty of good reasons for that, and it's thanks to a lot of that extra effort that we aren't even further behind than we are. It could easily be much more than that. So I just want to thank all the staff involved for the effort that goes into that and to provide the information that the boards and committees need to proceed with the budget process for FY23. And then I also just want to mention Town Planner Kathy Joubert, who retired at the end of December. Kathy was just the consummate professional, always very busy, always doing the extra things that were needed to try to get information or work with applicants or work with the board to get through the planning process. The thing that struck me about Kathy is like she always just had a wonderful sense of humor about it all, even though she's working till 11 p.m., 11:30 p.m., midnight some nights with meetings and follow-ons after the meetings. So I just appreciate all the years of service that she put in. It's not clear whether that's 35 or 37, and if you factor in some of those extra hours, it's probably closer to 40. So just congratulations to Kathy. We have some applicants for the position. We're going to fill the position, but we are not going to replace her. So just want to congratulate her and thank her for all the years of service. We really, really do appreciate it. And that concludes my report. John, anything?
I'm just going to echo the same thing on Kathy. That's a big hole for us to fill. We're in that process, but the institutional knowledge that she carried and she was just a rock for us, and very, very much going to miss her. So we're very lucky in general. We have a really excellent management team. And one of the things that you'll find, you had Kristen on, you've got Scott, you got the 2 chiefs, myself, Jason Little here, you're just going to find that the group works really, really well together. You've heard the chiefs, particularly Dave Prente, say this often, that there's no sandbox issues. And Kathy was a big component of that management team, and we're going to miss her. But she's I already asked her how she's doing, and she said adjusting quite well. So I think she's going to be okay. It's us on board, but that's all I have. Thank you, though.
Very good. Thank you, John. That brings us to public comment. If any members of the public wish to offer public comment, this is open-ended. Any topic that you care to comment on is fine. Now would be the time. If you wish to comment, we'll bring you in, ask you to first state your name and address. You'll have 3 minutes, and we ask that you present in a professional and respectful and constructive manner. So having said that, do we have anyone who'd like to offer public comment this evening? And had a hand up and the hand went away. There he is. Mr. Hirsch, welcome back.
Thank you, Mr. Perot. I'll keep it brief because I know you guys are probably exhausted from this long meeting, but I just wanted to send out some praise to Chief Liver for his decision to have the Northborough Police Department participate in our 20th annual Goods for Guns gun buyback. Northborough got the second highest total of any of the 9 communities that were participating this year. And he's been a real stalwart supporter of this program, of course, along with the other communities and DA Early who have helped us finance it. So thank you very much to the chief and to the city for picking such a good chief.
Thank you.
Thank you very much, Mr. Hirsch. And anyone else for public comment? Going once, going twice. And thank you. Public comment is concluded. New business. First item is execution of cemetery deed 1137. Do I have a motion?
Mr. Chairman, I move the board vote to execute cemetery deed 1137.
Second.
Moved by Julianne Hirsch, seconded by Scott Rogers. This is a roll call vote. Kristen Wickstead.
Aye.
Julianne Hirsch.
Aye.
Scott Rogers.
Aye.
Leslie Rattan.
Aye.
And I, Jason Perot, vote aye. Any other business to come before the board?
No other business this evening, sir?
Nothing more. Do I have a motion to adjourn?
So moved.
Second.
Motion to adjourn by Leslie Rattan, seconded by Scott Rogers. This is a roll call vote. Kristen Wickstead.
Aye.
Julianne Hirsch.
Aye.
Scott Rogers.
Aye.
Leslie Rattan.
Aye.
And I, Jason Perot, vote aye. So we are adjourned. Thank you all this evening. Have a good night.
Thank you.
Thanks all. Good night.